Estrogen loss at menopause is a real problem for vulvas and vaginas. Hi everyone, I'm Dr. Lori Davis. I'm a sex counselor and menopause specialist, and I'm here today to tell you about the 5 things you can do right now to prevent pain with sex after menopause or to treat it if you already are having symptoms. So real quick, here we go. Number 1, stay active. And I don't mean go for a jog. I mean that you need to stay active in your vagina and vulva by engaging in all of your favorite penetrative play activities, or by doing things that are a little more therapeutic with stretching activities. So you can use your finger, you can use a vibrator, a dilator, your partner's finger or other body part. But the idea is that you want to keep engaging in some penetrative activities that will maintain flexibility, especially at the opening to the vagina. Okay, number 2, keep the blood flowing. So vulvas and clitorises need excellent blood flow to stay healthy and to stay functional. So how can you help them out? Well, by engaging in your most favorite pleasurable and arousing activities. Heck, maybe even throw in an orgasm or 2 from time to time. Your tissues are going to love you for it. You just want to keep them doing all their favorite things, and this is what's going to keep them healthy. Okay? Number 3, use an excellent lubricant. So I tell my clients that they should use a lubricant every single time they engage in play with a vulva, premenopausally, postmenopausally, every time. There are lots of great lubricants out there and several considerations around which one to use and when. I'll be posting more about that soon. But in the meantime, just know that for postmenopausal women, I usually recommend something like a silicone lubricant or coconut oil because they're extra slippery. Okay, number 4, consider hormonal therapy. So it makes a lot of sense to me that if the problem here is that estrogen is going away, that if we could just add a tiny bit of estrogen back in topically, that'd be a good thing. And it turns out it's true. So local hormonal therapy is an excellent treatment or preventative measure for these symptoms. And estrogen therapy used locally is safe for most women. So I tell women in my office, look, after menopause, you're gonna, brush your teeth regularly and put on sunscreen, but you also need to use a little bit of hormonal therapy on the vulva and vagina to keep it healthy long-term for the rest of your life. It's just that important. It needs to become an essential part of self-care. I know a lot of you have questions about the safety of this or questions about the use after breast cancer. And please know I will post more about this also, so stay tuned for that. And then number 5, I've saved the best for last, and that is keep the focus on pleasure. So I think, as has been made clear here, the vulva, the vagina, the clitoris really need pleasure to stay healthy. And that's also true for the rest of you, okay? So pleasure heals. It heals our body, it heals our mind, it keeps us connected to ourselves and our partners, and it's really essential for a good, healthy life. So I highly encourage you to engage in more pleasure every day in every way you can. So this has been a really quick romp. I appreciate you guys tuning in and know that I will post more on all these topics soon. I look forward to your questions and comments and engaging with you all. All right, have a great day. Thanks so much.